Night terror, confusional awakening, coffee is good, and some physical activity can improve apnea.
If the patient is obese, losing weight will improve apnea, so we have to address it and not romanticize obesity as the biggest risk factor, maybe, for sleep apnea. Many people who go through sleep paralysis talk about situations that are almost spiritual. The feeling that there's a stranger in the room watching, or even an entity sitting on your chest.
Then I had a question. Is killing while sleeping a crime?
A father who got up and threw his child says he was dreaming about American football or baseball.
Would you acquit this father? When we stop sleeping, we age more. They've already invented a 100% safe medicine to help people sleep. Do you believe that the guests at the wedding in Cana in Galilee, when Jesus turned water into wine as the Gospels tell, slept poorly that night? What if I said your talking here is making me sleepy?
Your internal clock signals it's time to relax and slow down.
I see all the time people who say they forgot to subscribe to the channel or that they didn't even remember to do it. So let me ask you a favor, subscribe to the channel, and if you really like our show, turn on the notification bell and share this episode with at least 3, 4, 5 people. If you can, then look. Thank you so much for subscribing and for being part of our community and the history of this channel. My guest is someone who only sleeps peacefully if you sleep too. In fact, he even has nightmares if you don't have a great relationship with your pillow. He is a doctor, specifically a doctor who is very used to dealing with extremely strange symptoms that medicine calls parasomnias. Things with curious names like somniloquy, enuresis, confusional arousal, and also terror. The night terror that causes some of his patients to wake up screaming and crying with an inexplicable fear, which later will be forgotten. My guest is an otorhinolaryngologist, and more than that, believe it or not, he really understands snoring, something that, yes, has a solution. Another specialty of my guest is apnea, and after all that, I just have to state the obvious. He goes by the nickname Doctor. Sleep. In today's show, we're going to talk about everything that keeps me, you, him, and half the world awake. Dr. Guilherme Brassanini, please come in. It's a pleasure.
Pleasure, thank you, In person, all good. Thank you for coming. Thank you for the invitation, Thank you.
Did you sleep well today, Doctor?
Even with a 9-month-old baby at home, we still slept well.
But do you always sleep well with a baby at home?
Of course, we need to be honest, right?
Yeah, right? Because I used to sleep through anything.
Right? But it's not always possible, especially with a little one now.
Put the microphone closer to you, please. You can turn it more good because that's one of the questions I have. Because how can a mother sleep well? And what about during pregnancy? That big belly, are you there? The father with a little child, it's enough to make anyone depressed, right?
It's complicated, It's very common both during pregnancy and especially after, right? When the child is born, for parents to have changes in their sleep, right? And it's something we always talk about. They're just phases, right? Sometimes we must accept this phase, realize things will be different, and adapt as best we can. No one needs to put so much pressure on themselves to have perfect sleep in situations that are simply biological and a little out of our control, right? So maybe if you put too much pressure on yourself, not just to have perfect sleep, but to have everything perfect. It turns out that many times putting too much pressure on yourself ends up creating stress that messes everything up. It actually has the opposite effect, right?
What exactly is your job? Do people come to you because they can't sleep? I'm dealing with insomnia, doctor. How does it work? What's their routine like?
Well, nowadays in my office, I see patients who have sleep disorders, right? So we mainly talk about the more clinical disorders, right? Snoring, apnea, insomnia, trouble sleeping, hypersomnias, excessive daytime sleepiness.
Hypersomnia, there are so many words you guys come up with.
Hypersomnia is the term used when the patient is very sleepy, right? Very sleepy, tends to sleep for a long time, long naps during the day. This can be related either to some change in the night's sleep itself, or even to metabolic or hormonal changes. Hypothyroidism, for example, is a disease where it's very common for a person to have hypersomnolence.
If you have any patient wanting to sell hypersomnia, I'll buy it.
You'll buy it now because you don't sleep.
It's hard, especially now because there are phases, right? With us setting up the whole podcast structure, I got really involved in every aspect.
Yes.
And then it's 3 in the morning, 4 in the morning, you feel like going to the bathroom, something like that.
And your mind just, boom, turns on.
It turns on and never shuts off again.
Like I said, you asked me, do you sleep well enough? But of course, when certain situations come up that demand a lot of your focus, your energy, and sometimes even cause you some worries, often your sleep is affected. That's very common. So knowing how to deal with these specific situations is a challenge, right? It's interesting to think this will pass. Maybe it's just a phase. It's okay to experience phases. What you can't do is turn something bad into something that doesn't have a solution later on, something perpetual.
So if I got it right, even Dr. Sleep suffers from insomnia.
It's very rare for me to have insomnia, but even this year I had episodes of insomnia from overdoing it.
Worry. What concerns does a Dr. Sleep have?
Actually, I not only have my own office, but I also deal with many issues at business clinics, right? So we get very involved with the worries, both with the patient and with the business. Sometimes situations come up where you lie in bed and it makes you think, wow, I have to do this thing tomorrow. I have to solve that problem. Something came up, so you keep thinking about it and just can't switch off, right? So this happens to any human being, right? And then many times I ask myself what to do to get out of this, right? I sleep really well, so I don't know. Have you ever heard of the term sleep hygiene?
I've heard of it, and I actually wanted to ask about it.
The listeners have likely already checked it, right? And heard about it, right? Sleep hygiene just means habits.
We have listeners and viewers there too.
So sleep hygiene is nothing more than habits and things in your routine that you put in place to improve the quality of your sleep. So from turning off the lights to getting close to bedtime, avoid screen time, don't bring work to bed, and use the bed only for sleep or intimacy, not eating or working. Stop.
Stop using screens, stop having screens. It's essential. It's essential.
It's essential.
We'll talk about that in a bit.
We'll talk about it, but just so you understand. I don't do all that. I don't do all that, not because I sleep well and don't need it. But when I start putting myself in situations where I realize my sleep isn't going well, I start having trouble falling asleep. Then I become super disciplined and do everything I can to improve, you know? So I really have to worry about it.
I found it interesting you didn't just say you go there, take medicine, and sleep. Later, tell me. I want to understand everything about the medicine. You mentioned several things you do. Could having too many tasks be affecting your sleep? I, for example, was here setting up the podcast, working on television, writing the book. When you start doing too many things, that affects your sleep.
You end up, this really depends on the person, but inevitably, if you have a lot of worries, the more worries you have, the more it can affect your sleep. Especially because sleep is the time, right? The time when your brain gets ready for the next day's activities too, right? So you need to rest. And many times you think, oh, I need everything you need. Every time you put too much pressure on a need, thinking that if you don't do it, things will go wrong, it often ends up being harmful. And with sleep, it's no different.
I brought up this issue of tasks because I heard about your experience. Mine is a bit like that too, but there's a historical figure, Leonardo da Vinci, who was a multitasker. The guy invented helicopters, wrote treatises on anatomy, and created magnificent paintings and sculptures.
He was a genius, right?
Legend has it the genius was a poor sleeper. I don't know if it's a fact that he had what's called polyphagia. That's it, he was polyphasic. He slept in short bursts.
In short bursts, exactly.
The question is, was it on one of those days that Da Vinci painted the Mona Lisa? Maybe?
Maybe he slept badly? Just kidding. Here's what happens.
Speaking from a medical point of view, he could have painted the Mona Lisa or one of his great works after a terrible night like that, or after a night of broken sleep like that.
Hardly, right? The Mona Lisa divides opinions, doesn't it? A lot of people say it's not really about beauty, right? They don't say, wow, what a beautiful woman.
Looks like someone agrees with me.
Do you agree? If you think about it, I do. Evaluating the symmetries, right? People often claim the Mona Lisa's symmetries are perfect. Because Leonardo da Vinci, he did everything within a certain logic, and he mixed a lot of geometric concepts with art anyway.
On a day of acute polyphagia, he could have created a masterpiece.
What is polyphasic sleep? It's sleeping in short intervals, like you said, and it seems, from what people say, right, that he had polyphasic sleep, which isn't common and isn't good, right? We, as humans, need a whole night of sleep. That's ideal, right? And it's okay to take a nap here and there. Some cultures, right, they have the habit of taking a siesta, right, which is when you take a long nap. Sleeping in the afternoon for a few hours before the invention of electric lighting. Actually, it was like people would sleep around 6 post-meridium and wake up around 10 post-meridium at night. They would socialize, have a small meal, talk, and so on, and then go back to bed and sleep again until the next day.
You're talking about the Middle Ages, about...
The Middle Ages and...
Before the Middle Ages, during the cave era, yes.
So that's pretty interesting too, isn't it? Thinking about the cave era, when humans had an important concern about the risk of being eaten by a predator, right?
A lion.
So, and it's very interesting. Midnight at that time was really midnight, so people used to go to bed earlier and wake up earlier.
Cavemen slept with the light on, right?
He used to sleep near the campfire's low red light, so when advising someone like an elderly person, you wouldn't tell them to keep the house totally dark. Since they could trip, fall, and break a femur, you're going to advise them to use horizontal and warmer lights like the cavemen did, you know? So it's actually an interesting analogy.
It depends somewhat on the overall type of light in your room.
Overall. White light, LED, the blue lights that are emitted by screens, those are highly harmful, while warmer, dimmer lights...
They're not as much back in a time when there were no cell phones, LEDs, or screens. Sherazad used to tell stories to make the Sultan fall asleep. She managed to make him sleep for 1,001 nights just by telling stories. She would tell those stories. They were wonderful stories, right? We know they're magical, right? Aladdin? Many great stories came from there, and the Sultan would fall asleep. He became so interested the next day that he wanted more stories, which delayed Sherazad's execution, though he still intended to kill her. The question is, what is the magic that Sherazad invented? She was a forerunner of sleep medicine.
That's a good question, you know? What did she do? It's nothing more than reducing stimulation, right? So, you know that thing about counting sheep? We'll go to And We Live Watching Care subtitles by the Amara org.
Bidayan, there are already stages.
There are stages. That practice of trying to let everything that comes to your mind pass, paying attention to something specific, your heartbeat, your breathing, something that really tries to block things out. External stimuli and internal thought stimuli as well, which can harm your sleep. So, from the moment you have someone telling a story, you get involved with a specific story that also can't be too interesting, because then it becomes the opposite, right? It actually helps you forget whatever is bothering you, any problem, removes external stimuli, and lets you fall asleep. That's where bedtime stories come in.
I've always had a question, which is, lullabies work too, right? Yes, they work hard, they really do. But how can a song like Black-Faced Ox Will Catch the Child Who's Afraid of Grimaces, which is terrifying, help a child sleep?
Do you remember when you were a child and someone sang to you? Could you picture that in your head?
Black-Faced Ox? I think that...
But as something scary, I've asked myself that question. Maybe not. I don't know. Maybe not.
Beautiful. It's a terror.
It's terror, right?
You're going to die. This song is almost torture.
Mom went to class, leaving the child alone.
Abandoned.
Abandoned. And then...
That's good.
Isn't it? If the child had this possibility, this development of the frontal cortex, which is the rational part, to be able to interpret this as something dangerous for her, maybe. But I think she doesn't have that ability yet.
So what works in the lullaby is this rocking that it gives.
The environment. Who's singing, right?
Mom sings better than Dad.
I'm sure it's mom. I hope not, because I want to put my baby to sleep too. See, when he gets a little older,
What do you do to get your baby to sleep? 9 months old. Many parents will ask what Dr. Sleep does with his baby.
honestly, that's all thanks to my wife. Because my training was all in adult sleep, not children's sleep. So she really went after learning a lot about the child's routine. She briefly hired a consultant to learn more about the profession.
The profession, your wife,
She is a businesswoman.
it's not about sleep, but about losing sleep.
She's really good at sleeping, man. She doesn't have a problem with that, but her company is big, so she should lose sleep many times with the problems that happen.
What kind of company does she work for?
She owns Doutora Zeri, Brazil's largest healthcare clothing company.
I just remembered our mutual friend Father Bessa took me there.
Look at that.
Look at that, I remembered. Now it clicked for you. Coffee, I went to the cafe, and next to it there's that thing, a hug.
Father Bessa. He's a real coffee lover, isn't he? Yeah, he is.
Coffee, it's good for you.
It depends on the time and how you drink it, also your relationship with caffeine. Some people metabolize caffeine very well and don't have much trouble sleeping with it. Some people are so sensitive that even drinking coffee at lunch can keep them awake at night. But everyone who drinks coffee at night, even if they fall asleep quickly, is affected because caffeine changes the architecture of sleep. You know those sleep stages? Rapid eye movement.
No excuse for that. Some say I can drink as much coffee as I want.
Yeah, you might fall asleep quickly, but it won't be quality sleep. It's just like drinking alcohol, which can reduce sleep latency.
I wanted to bring that up since we'll have the right setting to discuss it. I want you to feel comfortable. Are you at ease? I am.
Man, I feel at home.
You're at home, so let me ask. I'll give you some terms to explain briefly, then we'll discuss a few in detail, okay?
Let's see if I know some of them.
Night terror, well,
Night terror is the child can have that night terror, which is what it is. She wakes up screaming. It's a cry that's practically inconsolable, and she doesn't remember anything that happened the next day.
it's mostly the child.
It's mostly the child at most, adolescent or adult. It's rare to have this issue of night terror.
Confusional arousal is...
Confusional arousals typically occur as someone transitions from rapid eye movement sleep to wakefulness.
Or the opposite, says Deva Garzinho.
Rapid eye movement sleep is when you're dreaming a lot, right? So this confusional arousal usually happens. It mixes sleep a little bit with reality.
So rapid eye movement sleep is the best part of sleep, right?
That's when you have more vivid dreams, right? So dreams are like, for example, as if it were a movie, right? You script it out.
That's when you dream. That's rapid eye movement.
That's when dreams are more vivid and scripted. You dream that, okay, I don't know, it has a beginning, middle, and end. It's really a story. There are dreams where you wake up and say, no way, that was a dream. It felt like reality. That's rapid eye movement sleep.
Usually it's the night after my insomnia. That's a fact. It happened from yesterday to today, after my insomnia, which wasn't very pleasant because it took a while. I tried to read, did a lot, and didn't sleep. I managed to sleep. I slept. It seemed very deep to me, and I dreamed. I had a terrible dream. I was with my father, who is no longer alive. We were inside a car. The car crashed into the one ahead, and everyone in the front car died after being crushed by an oncoming bus. And then we were surrounded by people who wanted to attack us, accusing us of having killed those people. What the hell was that?
Nightmare. This is a nightmare disorder.
But that was in the dream. Rapid eye movement.
Possibly because nightmares are a parasomnia of rapid eye movement sleep.
There's the good rapid eye movement and the evil rapid eye movement.
There is. But nightmares usually happen so much that the treatment, there are people who really have a lot of nightmares, night after night, night after night. One treatment uses medication that slightly inhibits rapid eye movement sleep, which also helps address the mental aspect. Of course, but it also inhibits rapid eye movement sleep, usually the parasomnias, right? Rapid eye movement sleep disorders, we often have to treat them by inhibiting it a little. Did he understand?
Rapid eye movement comes from the English rapid eye movement, right? Which means an accelerated movement. It would translate to eye movement, rapid eye movement. So we move our eyes while dreaming, right?
And it's really funny. Everyone has a little kid, a baby. When the baby starts to fall asleep, their eyes twitch. They enter rapid eye movement, the baby. They enter rapid eye movement sleep, or they sleep and enter rapid eye movement. It's really funny, different from adults who take about 90 minutes to enter rapid eye movement sleep. Animals have rapid eye movement too, right? See, look.
The little dog is trembling, right?
His little eyes are twitching. He makes a little noise like this. He's in rapid eye movement sleep.
That's a good sign.
That's a good sign. Some people get scared by that, right? So rapid eye movement happens during rapid eye movement sleep, right? And we say that the more rapid eye movement there is, the higher the rapid eye movement density. We can see this in a polysomnography test by looking at the electrooculagram, right? We use this sensor to detect rapid eye movement. To diagnose rapid eye movement at that moment while reading the test, we must identify the rapid eye movement. It's a type of criterion used to determine if someone is in rapid eye movement, which also protects us since we experience rapid eye movement. It's a sleep stage where we're dreaming a lot, vivid dreams, dreams of hunting, fighting, running away. And when you
Try to punch, but your arm won't move.
hopefully not, or someone nearby might get hit. That's why we have muscle atonia. So during rapid eye movement, guys, our whole body relaxes. We go into atonia and can't move. Yeah, that's funny, right? So yeah.
It's funny, isn't it? It's terrible because you're there and you get punched in the face and you can't fight back, right?
But then when you wake up, become alert, your tone recovers. It's supposed to recover instantly. Some people don't recover and some lack atonia, which leads us to consider rapid eye movement sleep behavior disorders.
It's the one who physically hits their partner.
It's the fact that there are several cases that are studied in law, right? Oh, in law, regarding homicide that happened during sleep.
Have you ever been called for a case like that? No, I haven't, but sleep doctors sometimes are.
It happens to explain and everything else, especially these issues that have come up as well. Nowadays, many people relate actions they've done to medications, right? Has it happened? Anyway.
I wondered, is killing someone in their sleep a crime?
That's the point, how this is even a philosophical bias, right? Because, okay, the person wasn't conscious, but the unconscious can't be judged.
What's your assessment? Can you convict someone who killed while sleeping?
We need to consider how it happened and what exactly took place, right? There's a case, I can't remember when it was, if I'm not mistaken, it was in the United States, of a father who got up and threw his child.
It was out the window.
It was against the wall, if I recall correctly. He claims he was dreaming about football, baseball, something like that. This father, maybe he didn't want to do anything to his son. In fact, it was really something related to sleep. Now, someone who, I don't know, stabs another person is completely different. Anyway, I think that
You would acquit this father?
if it's proven the father has rapid eye movement sleep behavior disorder, yes.
Then he must take an exam.
What is the exam that is done? Polysomnography identifies that the patient doesn't enter atonia during rapid eye movement. He has preserved muscle tone, speaks slowly.
Lots of terms make it hard to avoid atonia, meaning the limbs keep moving.
They stay toned, right? The muscles remain active. During rapid eye movement sleep,
Normally you dream and don't move. It's like the control is turned off.
you see the electromyogram there, right? Which is the sensor that evaluates muscle tone. And you see that it drops during rapid eye movement. If this guy claims that, and he really has an absence of atonia during rapid eye movement sleep, he actually has a possibility of having this rapid eye movement sleep behavior disorder.
This guy would be acquitted.
Possibly.
That can be proven in a laboratory.
In a test, you can prove that he doesn't have it. You can't prove anything else. You can prove that he has a change in rapid eye movement tone, which he shouldn't have. So, if you see a patient with increased tone during rapid eye movement sleep, that's not physiological, it's not normal. And then, if you suspect a rapid eye movement sleep behavior disorder, it's necessary to do a polysomnography with video. So you do it in a sleep lab with video, with a camera.
This will be evidence in court.
It will even assess if he actually has movements, when he has any abnormal behavior during sleep and things like that. Always request a video evaluation for any parasomnia, including sleepwalking.
What's the most advanced sleep machine today? I want to move on to another point. There is already a machine capable of reading dreams and nightmares.
It doesn't exist yet. They study a lot about brain area activity, right? The areas that are activated during a specific dream, and they're trying to figure out what might be related to something here. There are already some showing that when it's related to fear, it activates. That's it. Why? Because when a person is awake, they activate that area of the brain, and when exposed, it's a fear situation during sleep as well. So they start to evaluate where this is going. But we still don't know how to read dreams, right? Is that it?
Do you think it's possible?
I think it's something that's impossible nowadays, right? After the advancement of artificial intelligence and the things we're seeing happen, honestly, nothing would surprise me anymore.
By the way, you mentioned artificial intelligence. One of the big disadvantages we have compared to machines is that they don't need to sleep.
They can keep working all the time.
So it's really unfair, isn't it?
Exactly.
If we don't sleep, we stop.
But we need sleep to function otherwise.
So I ask, can we compare sleep to recharging a cell phone battery? We can't.
Okay, totally, but it's good sleep, right? Or maybe it's that sweaty battery.
The cheap charger?
The cheap charger that runs out quickly, right, anyway, and still breaks the device after a while. So you need to have quality sleep to recharge, right? And we're talking not just about the amount of sleep, but the quality of sleep, the cycles we need to go through, the stages we need to reach during sleep. It's about both sleep quality and quantity.
Behavioral disorder, that's it.
We discussed behavioral disorder, mainly related to rapid eye movement sleep. Specifically, rapid eye movement sleep behavioral disorder. Abnormal sleep activities.
There are examples of these things we've talked about so far. Confusional arousal. Behavioral disorder is confusional arousal.
Many times it's when you wake up.
Not examples from patients. Names omitted, of course.
Confusional awakening comes to mind since it usually doesn't bring the patient in. He says that it has happened before, that he woke up and didn't know where he was. Something like that anyway. Some kind of behavioral disorder. Yes. I'm seeing some uncommon patients. Even in our medical discussion groups, cases of sexsomnia are rising. So what is sexsomnia? Sexsomnia is sexual activity while sleeping, so the person wakes up masturbating or trying to have sexual intercourse with their partner. That ends up causing a significant conflict in the relationship, right?
It might be considered rape.
And there are already cases where a complaint about this, sexsomnia, has already been made. In this case, it's more like sleepwalking during non-rapid eye movement sleep, not rapid eye movement sleep. The one where the person wakes up and walks around the house. Then, while sleeping with sexsomnia, that's not during rapid eye movement sleep, the person is walking around.
But sexsomnia is something new.
It's probably not something new, but it's something that's been showing up more and more. Sexsomnia.
Do you think so? We just talked about cavemen a little while ago. Do you think cavemen also had sexsomnia? Sexsomnia?
Good question. Maybe not. I honestly don't know. But more and more there is stimulation. There is the access that people have, especially to pornography nowadays, and all the time. Stimuli, stimuli, stimuli. I think there might have been, but not like today, you know?
So if the partner tries to grab the other, or vice versa, if someone tries to grab someone at night, it's probably because they're watching too much pornography.
I wouldn't say that, no, I don't think so, but it's something we have to take into consideration. It could be correlated, you know? Since it's a disease, you can't assume it's caused by something specific, right? Many times it's related to anxiety, stress, overwork, sleep deprivation, so it's all the same reasoning you use. For sleepwalking, it's rare for adults to have sleepwalking. There are times when the incidence increases, when you're actually more anxious, more worried, with some kind of psychological change, we could say.
I have a friend who sleepwalked and nearly killed himself by going onto the balcony, but his wife caught him just in time. A person who does that is really trying to kill themselves.
That's not why someone is a sleepwalker. One of the recommendations is that you first have to talk. It's a non-rapid eye movement sleep disorder that's benign, meaning it's not a disease and won't cause harm, though accidents can still occur. So you need to lock drawers with knives, you need to protect places with screens so they don't fall, lock the house door with a key, so all of that.
What's going on in someone's mind who
is sleeping, is in a deep sleep.
And then why do they get out of bed?
It's a change that happens at the brain level where the person simply gets up, but they're still asleep.
But they think they're walking? No.
You can talk to them, but they're unaware of what's happening.
Look, it's open.
It can be open or closed.
She can walk with her eyes closed, but she'll hit the wall.
She might hit it, but she'll open her eyes. But she won't wake up. Most of the time, sometimes she gets scared and wakes up.
Sometimes she might hit it and not wake up.
She might come back, know the way, but the most common is with her eyes open.
How is sleepwalking different from the case you mentioned where someone hits another person?
Phase alteration. Sleepwalking happens in a non-rapid eye movement phase. Deep sleep is not deep for the sleepwalker. For the sleepwalker, it's deep. Oh, it's rapid eye movement sleep, not deep sleep. That's confusing, right? They say they get a lot of rapid eye movement or deep sleep, but deep sleep is slow wave sleep, N3, while rapid eye movement sleep is different. So let's explain this part, which is interesting. Deep sleep is different, I'll explain, so let's do it. Like this. We divide sleep into two main phases, okay? So let's not count wakefulness. Sleep has two main phases, rapid eye movement and non-rapid eye movement. So we divide it there.
What comes first?
When you fall asleep, you enter a transitional non-rapid eye movement stage between wakefulness and sleep.
How soon will I enter rapid eye movement sleep?
Usually after 90 minutes, on average 90 to 120 minutes. What happens is that you enter light sleep. N1 is the transition sleep phase you pass through quickly before reaching N2 or light sleep.
What do N1 and N2 mean?
N2, these are stages, stage 1 stage.
This N means something.
Stage 3, right? It's non-rapid eye movement.
So there are three?
There are three non-rapid eye movement stages, N1, N2, and N3. Previously, there were 4 stages, 1, 2, 3, and 4.
What changed?
Stage 3 and 4 were merged into one.
This is a scientific matter.
It was study, right?
We didn't change.
Right, it was deep sleep, so N2 is light, N3 is deep sleep or slow wave sleep, where there's a slowing down of brain waves. The waves get really, really slow like that, and high, deep sleep. Completely unlike wakefulness, where waves are fast, random, and low in amplitude.
When does wakefulness happen?
Wakefulness means being awake. Oh, okay.
All right, I thought it was something else.
It's really extreme, right? Funny enough, after a long afternoon nap, you sometimes wake up grumpy. You were probably in a deep sleep.
In a bad mood, right?
Since you'll call again, you'll wake from deep sleep to rapid brain activity. Your body reacts, wondering what's going on.
Okay. And then we come back to the question of the siesta that the Spanish take. They still do, right? I think the Portuguese used to do it.
They must complete one full sleep cycle. That lasts longer because he cycles through light, deep, and rapid eye movement sleep, then wakes up.
Napping in the afternoon is a good idea.
It depends on the person. For insomniacs, no. Not if you're an insomniac, since you need sleep pressure. There's an increase of adenosine in your brain, which is the product of the metabolism of everything we do. We spend energy and adenosine accumulates in our brain. And that's what makes us feel sleepy, this molecule, adenosine. When we sleep, we clear it out. It's like a cleaning process. So if you're an insomniac, you need sleep pressure. You need that concentrated adenosine. If you sleep, you lose it. At night, you don't have it. It's like that elderly person who comes to the office with their daughter, and the daughter says, "Mom doesn't sleep." Then I ask her, "What's your routine?" She replies, "Doctor, I spend all day on the couch." "Do you nap?" She says, "Yes, a few small naps." "But what are those naps like?" Then the daughter jumps in and says, "See, she already notices, right?" She says, "Yeah, Mom sleeps. Whenever I see her during the soap opera, her eyes are closed. Then she sleeps at night too. I spend the whole day taking those naps in the middle of the soap operas that she watches all day long." It's common for elderly people to doze off during the day, making it hard to sleep at night. It's not insomnia, they're just not tired after daytime naps.
So what do? You have to give coffee to this elderly person.
You need to encourage activity and adjust the environment, right? Changing an elderly person's lifestyle is more complex than just offering coffee. It's about trying to help them have better social integration.
They have to move.
They have to move, be more active, right? So we try to work a lot with these stimulation issues and everything. Sometimes there are elderly people who are very aware, they already understand it, and they change, right?
Exercising always helps with sleep.
This is invariably true, right? Physical exercise is fundamental, right? It produces hormones that will really help your sleep become more stable, right?
Does daytime tiredness improve sleep?
It's also good to get tired during the day. It's good because you end up producing more adenosine, more accumulation of adenosine in your head, in your brain, and that increases the pressure, the sleep pressure. You get it?
Let me tell you a story. There was a time when I was traveling a lot between Europe, Brazil, and the United States, A lot of time zone changes, and I had a tendency to fall asleep in any situation. I was in France once, met a friend, and during dinner, I started nodding off at the table. I was very interested in the conversation and wanted to talk to him, but I couldn't stay awake. I went to give an interview to Joe Soares the next day. After arriving from a trip to Brazil, I kept pinching myself so I wouldn't fall asleep during the interview. What's the name of that?
Were you there? It happened when
After long trips, when you sleep poorly at night,
you were sleep deprived. That's a fact. One thing that could happen depending on the time zone is that you might also be out of your own time zone. That's something that happens a lot, which is called social jet lag or non-social jet lag. Actually, it's travel jet lag. Jet lag for trips. Jet lag when it's really about traveling. It's when you travel across a few time zones. But all your hormone production is still happening on Brazil time.
the hormone knows where it is, you sleep.
It's circadian rhythm, so it's that rhythm that's about 24 hours long. That's what the circadian cycle means, which is nothing more than our internal clock, our biological rhythm. So there are hormones that have a circadian pattern. So always at the same time, they will be metabolized or stop being excreted. This works day after day. Among them is the melatonin cycle, which is the nighttime hormone. We say it's not the sleep hormone. For example, nocturnal felines produce melatonin at night, and for humans, this hormone greatly aids sleep. So,
It doesn't work for a cat or a jaguar.
it's different, right? They produce the same thing at night, but it's for something else. Melatonin is very important, right? For each species, it's related to something different. For humans, it's crucial for sleep.
Melatonin made me nauseous and didn't help me sleep.
But that's because you took melatonin. We're talking about endogenous production inside the body.
You don't recommend melatonin?
Not for everyone, it's not a supplement. Taking it doesn't guarantee better sleep. In fact, if misused, it can harm your sleep, increase nightmares, and cause lingering drowsiness. The next day, it can disrupt your body clock. So, melatonin is not synonymous with improving sleep quality. We use melatonin to regulate the circadian rhythm. Someone with an irregular schedule, sleeping at 8 one day, 10 another, midnight the next, then 7, has a completely disrupted rhythm. The biggest signal for our biological rhythm is the sun, so the presence or absence of sunlight, light and dark. That's what sends signals to our brain, showing it's day, it's night. This synchronizes our biological clock, adjusts our clock. The second best synchronizer would be exogenous melatonin, so we can, yes, use melatonin to synchronize. So, for example, a patient who needs to sleep at 10 o'clock at night will take it every day, strictly at 9 o'clock at night to regulate their biological rhythm. It's a signaler.
Melatonin as a supplement?
Then it's like medication. You don't even call it a supplement, right? Supplement is the wrong name they give to melatonin, right? It's not a vitamin, right? It's a hormone, so it's not even a supplement. It's just that the commercial side, I don't even know if I can talk about this here, but the commercial side of melatonin, when you say the commercial side of melatonin, the appeal, even commercially, is to call it a supplement because it was easier for approval, for example, by the regulatory agency.
But it's not a supplement.
Melatonin isn't a supplement, and the dose sold in Brazil is very low, so I'm not too concerned. Patients usually buy low-dose melatonin from the pharmacy.
But they shouldn't be taking melatonin like that.
Not like that, especially in large amounts from abroad, right?
But do you prescribe melatonin when...
It's indicated for patients with circadian rhythm disorders, patients with jet lag. So like, I'm going to Dubai, I have an important meeting, I'm going to stay there for 7 days. What's the time difference in Dubai? 8?
It might even be more.
It's even more. So you'll need 8 days to synchronize your biological rhythm because when you travel across a time zone, your body adjusts by 1 hour per day. So like if you produce melatonin here at 9 every hour, it will eventually start producing it at the local time there. Got it? Through the synchronization of the light and dark cycle.
If someone travels to Dubai with a 7 to 9 hour time difference, they won't adjust if they stay just 4 or 5 days.
They adjust but won't reach 100%. Ideally, try melatonin an hour before your usual bedtime. There, you're taking a dose of melatonin so you can sleep at a time when you normally wouldn't have melatonin, so that's it. Another indication is for patients who are night watchmen, night shift workers who need to sleep during the day. They make melatonin at night, so we need to give these patients melatonin in the morning, for example.
We talked here about social jet lag, and there's a kind of social jet lag which is the guy who drinks on the weekend.
That's social jet lag. I got confused earlier. Travel jet lag is different, while social jet lag is what you experience here. A sleep pattern from Monday to Friday, but on the weekend it changes completely. That's social jet lag. And that's wrong too. It's a tragedy. It's bad because it messes everything up, right? So, of course, it's that thing we were talking about at the beginning. There are phases, right? If it's something like, well, college, that's okay for a while, but making this a routine will really harm you, increase cardiovascular risk. Actually, that's a thing.
I'll insist college is fine and it's okay to sleep poorly sometimes, but not always.
It's not really okay, but those are just phases. You'll have a party there. The problem is carrying this on your whole life, right?
Or if it lasts throughout your entire college years.
It's throughout your entire college years.
Maybe, so it's from time to time, yeah.
That's right. Not letting this become a routine, right? And with each passing day, the older you get, the harder it is to recover your sleep. I avoid saying recover lost sleep since you can't actually recover it. I've tried, so I know.
That was the other question. When we stop sleeping, we age faster.
We definitely age faster.
We won't recover.
You can't trade sleep for recovery. Heard that before? You don't give it away and then get it back later.
A bad night's sleep is a loss forever.
It's like a deposit. You just put it in.
How is it? Is it possible to recover?
You can't fully recover lost sleep. Studies show that sleeping more on weekends after being sleep deprived during the week helps a little, but not completely. So it's ideal for us to understand this, besides the fact that you're also messing up your biological rhythm, right? Sleeping differently during the week and on the weekend, sleeping more, that's already bad in itself, but you can recover a little, but not completely.
And the child or teenager who decides to study, I'm going to pull an all-nighter studying because there's a test tomorrow.
It's the worst thing in the world, right? Because it's during rapid eye movement sleep, for example, that they'll consolidate those memories so they can perform on the test. And if they don't sleep well, those memory drawers will be closed and they won't be able to open them when they need to.
So that's just foolish?
It's foolish.
So it's likely that the student who studies less and sleeps better will do better on the test than the one who stays up all night.
Man, your question is really interesting, and yes, it's true, and look how interesting this is. There was a study done here in Rio Grande do Sul, here in Brazil, that compared two schools. The school where people studied in the morning was actually just one school with the same teacher and study, no bias. Afternoon students had better grades. The only thing you can really take from this is the amount of sleep.
It's not that having a set wake-up time makes us sleep poorly.
But it's also a social issue. People go to bed later, right? So think about it here in São Paulo. We're in a city where it takes an hour to get anywhere. Go ahead. A child starts school at 7, which seems too early. 7 or 8 o'clock is early, isn't it?
Right.
So they have to wake up. She needs to get ready. Have a snack there, eat breakfast, and take the transportation that goes to her school. Still, this child often wakes up at 5 a.m. to reach school by 7. When is her bedtime? Kids need more sleep than adults.
So what time should she go to bed then?
Should she go to bed at 7 p.m.? She usually goes to bed at 7 or 6 p.m. Do you understand where I'm getting at? That father who works all day, comes home exhausted and missing his son and daughter so much. And the child stays up waiting for the father, then he gets home, there's excitement, they play, then the child goes to sleep at 10 at night and wakes up at 5. This child is being deprived of sleep and harmed in an irreparable way we can't even measure. Those are synapses being lost, learning that isn't being consolidated, skills that aren't being stimulated.
So the question is whether we should think about the well-being of sleep, about our own well-being. Society's clocks are wrong?
They are wrong. Look, you've come to a very important conclusion about changing this in Brazil, where we know how things are. Someone needs to open the store at 8 a.m. She needs to drop her child at school, but how will that work? Will the school open outside normal hours since she has to work? So, it's a change that's not just a simple change. School schedules are more complex, and some places are starting to recognize this. Some countries are beginning to adjust school hours and schedules.
For example, I think the Nordic countries are making schools start later.
Also, if I'm not mistaken, Japan as well. Anyway, there are some places in the world that are already starting to change this, especially for the younger kids.
May I suggest an exercise?
Let's go.
Let's imagine what the society's clock would be like if it were set for sleep, what time classes would start.
The classes.
For the children,
In general, the ideal would be in the afternoon. Think about a period of
if we had today's longer 7-hour school day, what time would it begin?
So what should we set then? It would start in the morning, maybe from 9 to noon, 10 to noon, and then a slightly longer period in the afternoon.
What time do people go out for drinks at night, considering this society's sleep schedule?
Drink what?
Go out for a drink?
It's something that's already happening nowadays, earlier and earlier,
Ideally, you shouldn't drink.
right? And now wellness is really in vogue, right? And we see that maybe our generation was the last one that drank a lot, right? And the new generations have changed. The consumption pattern is one where people are increasingly concerned about healthy aging, exercising, and eating well. That's why there's such a big growth in new supplement brands and everything else, because it's a major trend of awareness for health. We can put it that way.
What is the ideal dinner time?
7 in the evening, 6 o'clock, which already happens in other countries. You have a small meal before going to bed, maybe some yogurt at most, right? Maybe a little fruit.
What is the ideal dinner weight in a perfect world?
The weight of dinner is high. If you eat poorly, it affects your sleep.
Eating meat at night.
Meat is heavy, right? It takes a while for you to digest it. So at the moment when you need to be fully relaxed, with all your blood going to your brain, you lower your breathing rate, your heart rate. While you're sleeping, your blood will be focused on digesting the meat you ate, right? That's something we need to consider as part of good sleep hygiene habits. A light meal is important.
Is there a little list of sleep hygiene habits that we could share with people?
Yes, there is, but I never really like lists. Because it seems like you have a magic recipe there that if you do all of that and check everything off, it's going to work. It might not work for you. Maybe that's not it. Maybe putting pressure on yourself to do everything perfectly is worse than just letting things happen more naturally, you know? So I'm one of those people who sometimes actually, it's been a while since I made a post about this on social media. But I have an article about sleep hygiene that talks about 10 habits to improve sleep quality. But you shouldn't get too attached to that, you know?
Best practices?
At least best practices. That's right. That's what we talk about and discuss. Sleep hygiene. We talk a lot about it. It's about your bedtime, but it actually starts when you wake up. If you wake up, for example, think about someone who works from home with the camera off, especially them. If they wake up and don't open a window,
Don't take off their pajamas.
skip pajamas, shower, and coffee. Just get up and go to the computer. Staying there is very different from opening the window, getting sunlight, and exercising. So, all of this helps you adjust your biological clock and makes you sleep better at night. So, not just right before bedtime. Everything you do during your day influences how you will sleep at night.
If we're talking about clocks all the time,
Clock.
this thing here messed up our sleep. The invention of time measuring mechanisms started with the sundial, the clepsydra, which used water, and there were several types of clocks. And suddenly, an hourglass appears that everyone can have, and suddenly Santos Dumont appears to us. To invent a watch that we carry with us where the heart beats, the watch is telling us that it's already time to do something else. Should we blame Santos Dumont?
Especially now with wearables and smartwatches.
I already had it here with me.
Just as it monitors you and extracts very interesting health data, it can also harm those people who pay too much attention and give more importance to the numbers on the watch than they should. Whether it's the ring or any device that monitors health or sleep, many times people pay more attention to that score than to how they actually feel. So sometimes when you ask the patient how their night of sleep was, they don't tell you, they say, let me show you, and then they grab their phone and show you, see, I had this much deep sleep. Even though it's an algorithm that's not completely accurate, it's not entirely correct.
You can't rely on that here, not to say whether you slept well or badly.
You woke up well.
Not by chance today, not me.
If you woke up well, you don't feel sleepy during the day, you're fine, you know. You don't have to take into account what the clock is telling you.
The cost is higher. It keeps vibrating. It notifies you that there's a message.
You become more alert, maybe even more worried. I really didn't sleep well. I hope tonight it rises from 60% to 70% so I can get out of the red.
It turns into anxiety.
It's anxiety, you know? That's a problem now. As doctors, we need to know how to interpret health data that wearables provide. That's important.
It can be useful for medicine.
For example, using a wearable for 2 years gives us 2 years of sleep data.
It's good.
It's good if you tell me, Guilherme. I had an episode where I didn't sleep badly in my life. It was August of last year when I had this problem. That problem, that problem. If you check your watch, it probably showed that there was a drop.
So you can use the smartwatch. I don't know what it's called. Each one has a brand, a name. You can use this here, as long as you don't pay attention to the results.
You can pay attention to the results, but as long as they don't harm you. Because from the moment that brings you distress, excessive self-demand, that could be harming you. Wearable devices now include rings that monitor your health and are more comfortable to sleep with. And remember that each wearable has its own algorithm, so it detects. It knows rapid eye movement, sleep raises heart and breathing rates, so maybe that's it. The watch detects heart rate and similar signs. It says he's in rapid eye movement and still, so he's in rapid eye movement, his heart rate dropped, so he's likely in deep sleep. He moved, so he's awake. That's the algorithm the watch uses. In polysomnography, we use it to determine if the patient is awake, in rapid eye movement, or in deep sleep. We are evaluating the electroencephalogram for brain activity, the electroculogram for eye movement, and the electromyogram for muscle tone. So there are 3 physiological variables for us to determine. The patient is sleeping, in deep sleep, in rapid eye movement sleep, or has woken up. Meanwhile, the watch is estimating better and better, and one day we'll have it at 100%. So, studies show that it's estimating well and getting better each time. The newer the devices, the better the sleep estimation. You still need to be skeptical and realize it's not completely accurate. But now monitoring day after day gives you long-term tracking data, and that's really interesting. For example, a patient comes to me with sleep apnea and sleep deprivation from a respiratory disorder. He stops breathing at night, and that fragments his sleep. When he reaches deep sleep or rapid eye movement sleep, his blood oxygen saturation drops. He sleeps poorly, and the watch shows me that he's sleeping poorly. If I prescribe a treatment for this patient and treat the sleep apnea, I invariably expect these numbers to improve. And I see that, so it's interesting. Within an intervention, you have a device that allows you to compare the patient with himself. But you need to know how to interpret it with the doctor. So, what does the American Academy of Sleep Medicine, which we, not just us, but everyone, ends up following to standardize studies and everything else? But what? What does it recommend? That the data from wearables should be shared with the sleep doctor so that only then they can be interpreted properly. Not by the user, not by the user. He shouldn't gamify, as it can lead him to use the tool negatively.
So gamifying is turning this into a little game, a little game.
You don't need to have a score of 80 or 90 yes.
Going back to my question, which we ended up changing to these clocks, but what about the clocks? The invention of time is a problem for humans. That's when we started having problems, when we started to realize it. I have a time to do this, I have a time to do that, I'm going to wake up at such and such time.
I didn't answer immediately because I need to think about this. It's complex and philosophical, right? What do you think?
Look, I have the impression that being aware of the time all the time can't be a good thing. That's my impression. I think my impression is that too much awareness is what harms sleep when we can actually sleep. That's just my layman's impression. It's exactly when I'm not aware of anything around me anymore and I just let go. If I'm always thinking about time, I'm also marking my brain somehow. It makes sense.
It makes sense. If you stop to think about it and you take a little away, maybe that less subjective feeling is if we only think in light and dark. Yeah, you don't really take into account what your body is telling you. You're taking into account what this is telling you. Look.
It's 8 o'clock. I already need to sleep. Or
6
o'clock is too early.
Previously, people would notice feeling tired and pay attention to the sky when there was nothing else as the moon's position changed. Something that in fact can have an influence. But without a doubt, if we're going to talk like that, what was the defining factor in society that changed people's habits, the way society sleeps?
What was the light?
The light.
The electric light? We should have Thomas Edison hanged and sentence him to death for taking away our sound?
But do you understand? It totally changed the standard because at a time when there was nothing else, you had a candle, which is just a little thing and all. But what did the light provide? Increased workload, people working more. So if you think about it, I would get into that point. To say that the crucial point, perhaps, for the change in society's sleep habits was with the advancement of light.
The screen's small light has made our sleep worse.
Social media is a big factor, right? It puts a blue light emitting screen right in our faces.
Why do you talk so much about blue light?
Because it's more harmful to our body. So we have there in our retina, we receive the light, and through the retinohypothalamic tract, we send it there. We use cues to distinguish day from night, and our brain connects through these signals. The cell phone and its light are both blue.
And it refers to daytime.
It really refers to daytime, and it inhibits the secretion of melatonin. You can produce melatonin, but it may delay production and lower your natural peak. Remember, just taking melatonin won't solve the problem.
Is it just the light or the news from social media?
Now we're talking about dopamine, which is another substance that totally gets a person addicted and makes them more alert. So, there are different factors because one is a light stimulus and the other is more of a psychological stimulus. Let's put it that way, but both are going to be harmful in different ways that add up, so it's a ticking time bomb.
Going back to Scheherazade, I really like to read before sleeping. It makes me sleepy. Even if it's the best book in the world, I'll fall asleep. If I read a physical book paper with a little yellow light, it's different from reading on an electronic device with blue light.
On a smartwatch, for sure, but not on a Kindle. The Kindle doesn't have blue light, for example. I'm mentioning the brand here because there are other brands, but people use the Kindle a lot, right? You asked me if the Kindle is a problem? No, it's not.
But light is still light.
But it's not as harmful, you know? So I would stay. I can even look for comparative studies about Kindle, for example, with a low yellow light focused on the book. But I don't think there are any. Still, I believe neither is harmful. Okay? But on the phone, definitely.
There's a trend that shows up in a lot of research that we tend to feel comfort in ancestral habits. The campfire gives us comfort. Eating around the campfire is something comfortable. Eating around the fire, it's something that reminds us of our ancestors, and it's somewhere here in our DNA. If we read at night by candlelight, would it be better for sleep?
Good question. Maybe, but you'll need to blow out the candle after.
You can't start a fire indoors.
Just be careful, right?
But in terms of how the brain adapts, how the brain understands,
it can be more relaxing. And not just because of the flickering of candlelight, right? That brings a different comfort compared to a fixed light, right? Monochromatic, we could say, right? Because there's still some variability there, right? If a breeze comes, it gets dimmer, so maybe even this flickering of the fire's light. It, in a way, Nina, the individual, right? I don't know if you agree.
It seems so to me. For me, it has that effect. I have one more term here, some to ask about. Sleep paralysis.
We didn't talk about sleep. Rapid eye movement. So that's it. If you're in a deep dream and your brain wakes up, but you're still in atonia, what happens is atonia.
Remembering that we can't move.
You can't move during sleep paralysis because you woke up while in rapid eye movement sleep. He wakes up, but his body didn't wake up. His head woke up, his brain woke up, so he turned on, but everything stayed paralyzed. He can't move. But that's a rapid eye movement disorder.
It's a defect.
That's it. It's very much like that. The incidence is also related to the patient being more stressed, more anxious. So the more these changes happen, the more it occurs. There's also a genetic pattern and everything. Once again, I went on a television show called Bendita Hora, and then the priest asked, so is this spiritual thing also related? Television Aparecida, yeah, is it related? Anyway, it was on, what's it called? It's the same one. It's not Television Aparecida, it's Rede Vida, Rede Vida, Rede Vida. It's related. So the spiritual part, I say that I can't really speak for myself. You have to explain the scientific side of things, right? And why do I talk about the spiritual part? Because many people who go through sleep paralysis, they talk about situations there, almost spiritual, really. The feeling that there's someone strange in the room watching, or even an entity sitting on their chest. So there are reports, even in ancient literature, showing this. Drawings depicting it, you can look it up for research later.
Depicting what?
A sleep paralysis episode, someone sleeping with a demon on top.
Zanotto, what is this demon?
She felt as if a demon was watching her from above. Because when a person like her wakes up, all her muscles are relaxed, including the external respiratory muscles, especially the thoracic ones, are relaxed. So she feels a sensation of greater weight. She can't take a deep breath, so it's normal to feel pressure, even when trying to breathe in. You don't get that expansion of the rib cage, right? So, along with the confusion of being between sleep, dream, and awake in a dark environment, not being able to move, the person experiences it as if it were a supernatural event. That's how they describe it, right? And we have to look at the biological side, explaining what's happening now. If there's something else related to it, then maybe it's something that science can't explain.
It could be supernatural.
As a doctor, I need to discuss the science here. This happens because you wake up during rapid eye movement sleep without relaxation. I'm unsure about the spiritual side, but psychosocial definitely. Is the habit of peeing during sleep?
In bed, is this just for kids or do adults do it too?
It can happen to adults too, but it's more common in children. We always have to look into other disorders, right? For example, a child who has outgrown bedwetting but still wets the bed often has sleep apnea. Bruxism, or teeth grinding, is another sign that could indicate sleep apnea, especially if the child also wets the bed. You have to be aware of the possibility of sleep apnea, and
After all, treating sleep apnea is one of your specialties.
the main issue is the respiratory part. I can't really say that, but it's like my core business, right? It's my core. It's what I like to do the most because that's my foundation. It's otorhinolaryngology. I started with sleep medicine and then otorhinolaryngology. It does the whole evaluation of the upper airway, so nose, throat, and that's where all these respiratory phenomena happen during sleep. So I came from that background, so nowadays that's what I do the most. From the clinical and surgical side, everything is mainly focused on snoring, sleep apnea.
When I was a teenager, apnea for me was a way to dive. Yeah, that makes sense.
Apnea means you stop breathing.
There's a great movie called The Big Blue that's about 30 years old. In Italy, two guys dive and stay underwater for a long time, holding their breath and seeing sea wonders. But sleep apnea isn't wonderful at all.
No, it's not that you stop breathing, but during sleep, when we're awake, we have conscious control over our breathing. So if I want to stop breathing now, to hold my breath, I can do it. If I want to breathe fast, to hyperventilate, I can do that. During sleep, we don't have that awareness. All our respiratory control is basically chemical, so there are receptors at the level of the respiratory center that detect the levels of carbon dioxide and oxygen. They say, hey, breathe now, don't breathe, breathe.
And apnea is when you don't breathe.
It's when you breathe, but then apnea is when you don't breathe. But obstructive apnea is when there's a stimulus to breathe, so the breathing process. The person tries to breathe in, but no air enters. It's obstructive, so that's obstructive apnea, right? So when there's a mechanical obstruction, whether it's due to enlarged tonsils that block the airway, obesity that causes it to close, or the tongue falling back there, that causes obstructive apnea.
Sinusitis or air.
Sinusitis, unlike nasal conditions, isn't directly linked to sleep apnea according to science.
There's the throat.
The obstruction spans from behind the nose to the larynx within a tube about 11 to 14 centimeters long.
What are the possible factors that cause apnea?
The main ones are the anatomical factors, right? Enlargement of tissues, soft parts, tonsils, base of the tongue, skeletal changes. So, for example, the patient has a receding chin, which we call retrognathia, narrow patients who have maxillary atresia, We often joke about Ronaldinho's face, likely due to a maxillary alteration that affects the thickness of his airway, which I humorously compare to a pipe.
The medical field calls this Ronaldinho's face.
No, but To explain it to the patient, that's what I say, you know. Ronaldinho's face with the exposed teeth and slightly open mouth is a longer face that we call dolichofacial. The doctor calls it dolichofacial, but it's a face that we know is narrow. The transverse lateral pattern is narrower and makes it so there's a more reduced channel, right? So when you think about the airway, it's like a tube, but it's a collapsible tube like a straw. So what makes a straw get narrower? Have you ever had a thick Ovomaltine milkshake?
It's going to get clogged.
Many times you try to suck it up and boom, the straw gets blocked, or even with a caipirinha you try to drink it. There's a piece of kiwi at the top and the straw gets clogged.
That's apnea.
That's apnea. The straw getting blocked. What keeps the straw from getting blocked is the density of the liquid you're drinking, the thickness of the straw, and the quality of the straw's material.
So,
the airway is similar. The straw's thickness is like the skeleton, and what's inside represents the soft tissues. So large tonsils or an enlarged tongue base affect it. A metal straw never gets blocked, but a paper straw easily collapses. That's like flaccidity and neuromuscular changes. Does the straw analogy make sense now? It's interesting for listeners to learn how airway dynamics work. And in the face of negative pressure. So when you create negative pressure, for example, when you're going to blow up a balloon, you're going to use positive pressure, you're going to fill the balloon. If you take a balloon and pull it, or if you take a water bottle and pull the air out, it will close, the walls will compress. That's negative pressure. So the airway closes in the presence of negative pressure.
So people who have apnea have some kind of obstruction, and this obstruction is usually caused by a physical aspect.
They either have an obstruction or a neuromuscular issue, like a weak floppy straw, which is common with aging.
It's psychological, never apnea.
Obstructive apnea. No apnea is psychological. Apnea is either the person breathes and it gets obstructed or they have it. It's more complex. Central apnea occurs when the respiratory center fails to send a stimulus, as in some cases. Mainly in patients with severe congestive heart failure, serious lung or heart issues, or neurological diseases, right?
Of communication within the body.
That's when the respiratory drive is completely out of control. It's more complex, but you no longer get the stimulus from the respiratory center to breathe.
And how is it? If the apnea is resolved?
Sleep apnea. There are a few treatments, right? First, I always say there's no magic fix. And even the recommendation I give you will most likely be different from another patient, and so on. And it takes into consideration both what I think is the right treatment for you and how willing you are to accept that option.
Device is called continuous positive airway pressure.
The continuous positive airway pressure is considered the gold standard treatment for moderate and severe apnea. For example, continuous positive airway pressure. It stands for continuous positive air pressure. It's continuous positive airway pressure. We haven't discussed negative pressures. Applying positive pressure to a negative one opens the airway and inflates the bladder.
Gold standard because it's good.
It's the standard and preferred reference for treatment, right?
It's usually the first one that's used.
It's the first choice in moderate to severe cases. But for example, if I have a patient, so didn't you mention sinusitis? A patient with chronic sinusitis and a severely damaged nose, continuous positive airway pressure usually uses a nasal mask, correct? Does the patient wear the mask? The device stays next to the bed, delivering pressure through the nose. If the patient has a completely blocked nose, how is he going to use continuous positive airway pressure? So, many times we operate on the patient or treat this patient clinically. This is to help them adhere to continuous positive airway pressure, not to treat the apnea.
Surgery can be a good solution.
Nasal surgery is a great solution, for example, to help with adherence to continuous positive airway pressure. I never tell patients that nose surgery will cure their apnea. It may help, but usually the nose remains the same. There are surgeries like pharyngeal surgery for snoring and apnea, right? Remove the tonsils, stitch the muscle, and perform palate surgery to stiffen it. Surgeries at the tongue base remove extra tissue.
All of that.
You handle skeletal surgery like maxillomandibular advancement. I do the soft tissue procedures.
Surgery.
I don't perform skeletal surgeries, so I don't do maxillomandibular advancement.
There's something like shaving the bones to clear the obstruction.
Usually called shaving, the common term used. It's mainly related to sinusitis, so we open and shave the area to remove secretion for patient understanding, not for apnea. For apnea, we remove and stitch the muscle and other tissues.
And can any physical activity improve apnea?
Weight loss in obese patients improves apnea. Understood? We need to address obesity without romanticizing it as the main risk factor, except maybe for sleep apnea.
So the chubby women in Botero's paintings, they probably had apnea with thick necks.
Right? Did they? They had thick necks, so you could probably draw them with a continuous positive airway pressure, right?
Maybe it would be today, right?
No? We're going to play, edit over there.
Let's have artificial intelligence make one.
People can create a Botero painting using the continuous positive airway pressure, I think.
We're talking, right? I just learned my grandfather did this. I never knew before. He used to talk and argue at night, my grandfather, sometimes even throwing punches and hitting my grandmother. What did he have?
We probably can't ever know for sure, right?
The apnea for sure.
Maybe another confusional arousal because he was talking.
He was talking and throwing punches.
It might be a behavioral disorder or possibly apnea. It's hard to tell. It's not uncommon for the patient to say they feel like they choked at night, and we can make a differential diagnosis. With reflux, can you believe it?
Reflux leads to apnea.
It can lead to that sensation of waking up choking. The difference between waking up from reflux and waking up from apnea is often that reflux causes a laryngospasm. What is that? The larynx closes? When the person wakes up, it doesn't open right away, so a normal person wakes up suffocating. They often sit up in bed and then the air comes back.
I've woken up like that before.
That's reflux, apnea. The patient is choking. They wake up without air but already gasping for air. That's the most common. Do you know how to tell one from the other? Not that with reflux you can't wake up already breathing, but yes, and reflux can make apnea worse because by causing inflammation in the area, it can get worse. It's hard for it to be a primary factor. Is that the only cause? Reflux is causing apnea, so we usually need to treat reflux in these patients.
What I was going to ask about medications is trendy now, that Zolpidem. Is it good?
Zolpidem is becoming less popular because people fear it and it's getting media attention. Even patients who need Zolpidem sometimes refuse it, saying, "No, doctor, I don't want Zolpidem," even though it has its uses. But it's a medication, so you have to know how to handle it, know the expected side effects, know how the patient might react, so you can guide them properly. Very well. If that's happening, you should stop taking it, not just Zolpidem, but the Z drugs in general, like Zopiclone and others. These medications induce sleep and help patients with insomnia. But it won't be prescribed for every insomnia patient or situation. There's no time for you to try to take this medication away.
Then you need to have time to withdraw it.
Ideally, that's how it should work, but some patients can't stop. However, if you can set a normal dose and usage pattern, like with blood pressure meds, it helps. If the patient is doing well, sleeping well, has no side effects, and isn't developing resistance, we continue the treatment. So the important thing is to know how to guide, not to prescribe for.
These black label medications are addictive.
They end up making us addicted. When I started with sleep medicine in 2018, people used to say that Zolpidem was very good. Benzodiazepines like Rivotril, Alprazolam, and Azepam were widely used, leading to higher patient addiction rates.
Alprazolam is also all of these?
They create chemical dependency, so even for patients, we have to gradually wean them off, right?
It's just like a drug is...
And many times we used to wean these patients off benzodiazepines with Zolpidem, but nowadays it's often the opposite. We wean patients who are addicted to Zolpidem with a benzodiazepine. But really, there isn't a villain. What matters is knowing how to prescribe and how to handle the medication. That's the most important thing.
They haven't invented a 100% safe medicine for people to sleep yet.
Man, they're studying doxas abroad and it could be the future, but here in Brazil, we don't have anything like that yet. What's it called? Doxa, if I'm not mistaken.
It's a complete novelty.
Yeah, and actually it doesn't seem to have the side effects that other medications have. Things are advancing a lot, right? In a really fast time, right? So I think we're going to have better and better medications to treat patients. And just to remind you, I don't like to demonize any medication, right? What we need to do is raise awareness in patients so they know how to use it and who to go to. Also, because if you go looking for medication, you'll find some doctor out there who doesn't work properly.
There's something I just can't understand. If we've known for millennia that literature telling stories is good for sleeping, if we know that lullabies help us sleep, if we know about meditation, why would anyone in their right mind take medicine to sleep?
Often people just want to avoid more worries and disconnect. Sometimes they just want to switch off, even though being switched on is trendy. How does this connect with things like Venvance? The Citalins,
which they say makes you smarter.
they make you more alert, right? So they're also used to treat certain disorders, correct? Mainly those related to hypersomnias, you use medications to maintain wakefulness. But there are many people who need to work a lot and need to sleep. So they turn on with Venvance, turn off with Zolpidem, turn on with Venvance. At some point, my friend, at some point your body at some point it takes its toll, you know? So this causes an absurd dependence.
For what to happen?
Eventually it will fail. This happened to a close friend, a doctor who was hospitalized.
He used one medication to stimulate himself, another to calm down.
You end up in a rehab clinic.
In your experience, is it possible to treat anyone without using medication?
No. There are people who need medication.
How disappointing.
There are patients who simply can't do it, right? There are real changes, whether from severe depression or a significant post-traumatic experience. Whenever he goes to sleep, he relives that, wakes up with that. So there are patients that you will always recommend. Both conventional therapy and often cognitive behavioral therapy focused on sleep disorders, especially insomnia, which, believe it or not, is the gold standard for treating insomnia. Cognitive behavioral therapy, not medication. The gold standard for chronic insomnia is cognitive behavioral therapy. We always combine medication with cognitive behavioral therapy. We try to taper off the medication and leave the patient without it. We always try to do that, but many times the patient can't manage it. Simply reducing any medication is already a significant achievement, you know? And there's also the thing that some patients come to you already fully adapted to the medication. But just because I visited a place saying it's bad and want to stop the medication, even though they're sleeping well, have no side effects and everything's fine. I asked, who prescribed this medication? You said Dr. Fulano. Can you give me his phone number so I can contact him? Sometimes a patient comes in who has been on medication for years, and now that they've finally managed to adjust their medication, they come to you to stop the medication, and you're seeing them for the first time. You need to stay humble and try to understand the source to gain better perspective. The very act of standing your ground, of keeping the medication, of not stopping the medication.
Overall, our society tends to overuse medication.
That's right, exactly.
It's easier for me to take a pill and sleep.
That's exactly it. And we know how things work in Brazil, right? Sometimes patients get medication without a prescription or a doctor's order. Or, like I said, doctors who don't do their job well, who just don't want to see the patient in front of them. So take this here. So it's not hard for you to get it. So if you decide you want to take it, you'll end up getting it somehow. That's a big problem.
Who snores more, men or women? Men.
Postmenopausal women tend to catch up to men, but never fully reach the same level.
She tries, but she can't.
She tries, but she can't due to hormonal factors, mainly the drop in estrogen, which is essential for the firmness of the airway.
Apnea causes snoring.
Snoring is the main symptom of apnea. So, when we talk about sleep breathing disorders, snoring is a breathing disorder. We call it primary snoring, right? Primary snoring means the patient snores without apnea. If apnea is present, it's called sleep apnea, which usually includes snoring. But Guilherme, can someone snore without apnea? Yes. Yes, that's called primary snoring. Apnea can also occur without snoring. My father didn't snore, but we discovered he had apnea.
What was the symptom?
There was a change in the 24-hour blood pressure monitoring, the ambulatory blood pressure monitoring. His blood pressure stayed high at night. I suggested a polysomnography after noticing something odd. We discovered the issue, and now he happily uses continuous positive airway pressure daily.
Oh yeah, and it solved the problem.
It solved it.
Every sleep problem has a solution.
We aim to solve every sleep problem and believe we can at least ease the patient's pain. That's it, guys.
Can you solve mine?
Let's try.
I can do it. I can handle it.
Let's try.
You can put me to sleep.
I think that question is actually making someone fall asleep is the easiest thing there is, and that's not the goal.
Then you took me to the place where a lot of people take themselves. When you talk about this, you say, having a little wine is good because I fall asleep quickly. It's true, but it doesn't solve it. Now it's not good. You know why? I want to invite you so we can move on to our second act, which is a universe filled with some things that can make you sleep or not make you sleep. Let's go.
Let's do it. Eh?
Let's do it. Yeah, man, already.
Hey, this one can stay here.
This one's yours. This one. Look, this is the microphone. This is for us. Our second act has a characteristic which is the following. First, we had a conversation. I think it was pretty deep. We talked about all the topics, at least the ones I had questions about, right? I brought them to the table there. Now, here we are at the moment where we can come together, we can talk freely, which is a tradition of humanity, right? You gather at the table to talk. Sometimes even rituals happen at the table, but it's also where we can relax a bit more. Yes, and we can feel comfortable. Would you like something to drink?
I'll join you only if you want.
Look, that's a dangerous question, so come on, you.
Drink wine?
White wine, red wine, beer.
Let's go with the red. Let's go then. Okay.
So I'm going to open a red wine. Let's do it. Look, let's open this one. Let's try it. Hold on. There's this one I've been wanting to open. They're all Brazilians here. Ah.
That's cool. I know this wine really well. It's a Syrah, right? Yeah, it's from the region of my wife's city. Ah, yeah, she's from São João da Boa Vista. It's in the countryside of São Paulo. Did you migrate with Father Bessa, or is that not related?
I didn't meet Father Bessa in Jerusalem.
Yeah, look.
I met Father Bessa in Jerusalem.
That's cool.
We became friends there.
Cool.
I lived there for 4 years.
Father Bessa is so impressive. Wow.
Are you religious? I am.
We're Catholic, the whole family, right?
And is that how you know Father Bessa?
So it was from one.
Cheers.
Cheers. It was from one. It didn't go well. A retreat. It was almost a retreat. So with the people from Canção Nova, it was even with Dunga. So it was him. It was Father Bessa at this retreat. I met Father Bessa there. And then we connected, and then through the internet, right? So I saw Father Bessa. He makes really cool content. Great, really cool. So I always commented something. Then he would come and comment on my stuff. We started to become friends. Even so,
I've already recorded with him, including a few things.
it's really him.
We once recorded in Magdala in Paris, and I often run into Father Bessa in various places around the world.
Cool.
We met in São Paulo recently.
He welcomed us in Portugal too when he lived there and spent the whole day showing us around. In Lisbon, it was really nice, and now that he's coming to São Paulo too, we had lunch together. He goes there. He always blessed my house, my clinic, the stores, and my wife. He is a doctor, a priest that our family loves very much.
He's a real doctor of the soul, right? I was going to ask a question that intrigues me, which is this. If doctors know the importance of sleep, it's clear. All doctors agree that sleep is important. None would say otherwise.
There's no way, right?
Who was the doctor who had the idea to create medical shifts?
Yeah, but it started because there's no set time when you might get sick, right?
How can I trust a sleep-deprived doctor?
It's hard. Unfortunately, yes.
If Da Vinci couldn't paint the Mona Lisa without sleep, then a doctor can't operate on me without sleep either.
Doctors on call often work all day without rest, then take night shifts for extra pay, sometimes pulling another shift before leaving.
And you trust this doctor?
You just have to trust, right? There's not much you can do. He's not at his best.
It wasn't better.
It's flawed.
The split?
It's a flawed system, our country.
No, Dad, it's the whole world.
Some countries are like that. My friend went to be a doctor in Australia. At least that's what she told me, though I might be wrong. It's not anywhere very reliable, but she's studying medicine there. It's very much like the intensivist he's hired, right? From 7 to 7, then another one comes in.
They're sometimes there 24 hours.
They don't stay there. That's the arrangement she explained.
Oh, no. I mean, here it's my sister-in-law, Daniela, who stays here.
She's a doctor?
I remember after college, she often came by.
That's right. After college, I did several 24-hour shifts.
And you've done it too.
I've done it. It's like
sleep.
So it's that broken sleep. Many times when you're on call with more than one person, you can often split the shift. But if things go wrong, like sometimes they did, both of you would be awake the whole time.
If things went wrong, a critical patient arrives.
Yeah, sometimes a critical patient arrives or a lot of people come in. That can happen too, right? So if a critical patient comes in, one of the doctors is responsible for the critical case and the other has to take care of the incoming patients. So that happens. This dynamic during a shift is common, right? So many times I was about to rest as I should and then I go rest. If you're in a place, sometimes you let the line build up and people start saying, is the doctor sleeping? There's a complicated cultural issue too.
I never understood that. I confess to you that I never understood that. Well, since we were already drinking wine, there came a moment I wanted, which was to ask, after all, is wine good for sleep? Or does wine disturb sleep?
Alcohol is never good for sleep, so we have to get rid of this myth of saying, I'll have a little drink and I'll sleep better.
Because early on,
It's still early because I sleep better with alcohol. It will always have a downside, especially in the sleep stages.
there's no discussion about it.
It doesn't even make the person fall asleep faster. Many times, when we say it reduces sleep latency, that you fall asleep faster, it actually makes your sleep more superficial. In patients who are predisposed to apnea, it makes apnea worse. It makes people snore who hasn't seen a friend, or maybe even you watching right now. I've heard this one. I only snore when I drink. Why is that? Because it's a muscle relaxant. So as a muscle relaxant, you relax the airway. That straw that used to be metal, it turns into a plastic straw because you drank, and then it vibrates more, you snore and have a higher chance of apnea.
There's a totally unrelated question. Why does the pig snore?
Do we need a veterinarian for this? It doesn't make that noise, but probably snores. Here's something interesting. French bulldog snores. I have one. A cheetah, she's a French bulldog. The pug, these flat-faced dogs, they snore.
So the pig is the same thing.
I'm mentioning this because they have apnea.
Dogs have apnea.
Pugs and bulldogs have higher cardiovascular risks, which is common in these breeds.
That's why the bulldog looks sad.
He has a face, maybe he's a brother.
Looks like he slept well, right?
It may not seem like it, but notice how the skeletal part is flat.
You don't want to eat?
Let's not eat a little piece.
I'll take this opportunity to thank our partners from Quejolatro Pronto who sent us these cheeses and these jams. This salami is entirely made in Brazil.
There's Quejolatro.
It's Quejolatra.
That's cool.
People at home will see it on the QR code we're putting on the screen. If you're in São Paulo, there are 2 locations. Stop by. It's wonderful, all from Brazil.
And Brazil, we have to say, right? Brazilian cheeses are wonderful. The cured meats are wonderful. Excellent tasting.
Try this cheese. It's delicious. There's a great one here, the blue cheese we now call Gorgonzola.
But that's right.
Respect the French origins. Gorgonzola is Italian, but Roquefort is French. How about that? It's good. Let me grab some.
It's really good. It's creamy.
Some foods are bad for sleeping. Well, the heavy ones.
The heavy ones, right? The heavy ones in general are bad. Beans, for those who have gas, yes, right? It's heavy, right? If I stop to think apple, I'm going to eat an apple. I think it's very important how much you eat and the time you eat. No matter what you eat, having reflux near bedtime is bad for you. Understand? Any food?
Wonderful.
Wonderful. Creamy, right? I don't know what. Really good.
It kind of looks like Swiss cheese, but it's not, right? It's different.
Yeah, it's really good.
Naturally, we can't eat barbecue and expect to sleep well, right? You can't have feijoada.
No way.
Pizza. It's fine for sleeping. You don't work.
Heavy foods are generally bad for you, no matter when you eat them.
Sparkling water or still water? Let me get your glass. Next question. Go ahead and speak.
No, it's...
Are you also only into sparkling water?
I'm into sparkling water.
Me too. I switched from soda to sparkling water.
Wow, I love it. Thank you.
Coffee, after all, there are people who say, I can drink coffee whenever I want. I have a brother-in-law, Luciano, who says that. He'll have dinner with you at midnight and get coffee there. He'll sleep just fine.
He won't sleep?
He won't?
No, he can sleep, but it will be lighter, more fragmented, with less rapid eye movement and deep sleep. Which are those sleep stages you mentioned, which are fundamental stages to repair our body, right? Even if someone claims to sleep, they're not truly sleeping. Like with alcohol, people say they sleep but aren't actually sleeping. Exactly. Have you ever drunk that much? When you go past your limit, things get more...
if I've ever drunk past my limit. I don't think I'm a liar. No, I have, especially when I was younger, right?
Don't you think sleep feels lighter? Sometimes you wake up feeling terrible, but other times, after just 4 hours, you feel rested. It's strange. I can't get back to sleep and it wears me out. Sleep feels valuable.
Alcohol isn't good for sleep. Coffee obviously isn't. What's the limit? Drinking coffee? At what time?
Let's try to generalize. There's one thing you can't do, right?
It's the minimum hours before sleeping.
Ideally, no later than 2 or 3 p.m. Okay. Ideally, since caffeine's half-life is about 8 hours,
It will stay active for around 8 hours.
half-life or 6, it will still drop to half its dose, right? So if you think about it logically, it's enough to maybe give you a bad night. That's why I said it. There are sensitive people who metabolize caffeine much faster, and there are people who metabolize it very slowly. People who metabolize it very slowly. Sometimes you need to take coffee away from someone, not even in the morning.
It might be due to its impact on sleep. Maybe my recent insomnia is from too much morning coffee. That makes sense.
That could make sense. We need to do some testing. Maybe also not cut out caffeine all at once because that could be bad for you, right? Yeah, that's true. If you're someone who's used to drinking coffee every day and all that, it can make you more anxious, more nervous, give you headaches, right? So there are withdrawal effects, right? You have to wean off coffee too and cut back little by little. Don't do anything crazy like quitting all at once, okay? You might end up feeling bad because of that, you know?
Does warm milk help? No, but doesn't it remind you of your mom?
Yeah, it might be comforting, right?
It's emotional, but the warm milk does nothing.
Nothing.
Milk doesn't contain anything that will make you sleep. But emotionally, maybe.
Chamomile tea works, but what effect does it have? It's mild and can make you a bit sleepy. Does it have any valerian or passion flower, which is passion fruit?
It's valerian.
It's a plant too.
It works too.
Yeah, passiflora works too. Which other ones are passiflora?
Mulungo, good teas for sleeping.
I don't really like to say it like that, you know, the good teas for sleeping, right? But I say that the ritual of making tea, the act of heating up water, smelling the aroma, that's going to be more important than the effect itself. But there are effects from chamomile, passion flower, valerian, mulungu. These are herbs, mulungu. But these are plants that provenly they can, yes, and they do.
Even when you go at night, you say like, honey, I'm going to have a mulungu to sleep, a mulungu these days.
I think it was my cousin that I told about it. He took it and said it really works. Yeah, really. But like I said, if you drink a bowl of tea, you're going to wake up to pee. Be careful. Reflux can make the whole night bad. Even if something is good for you, don't take it daily. Anyway, you have to know how this substance works for you. Some people with chronic insomnia use medication, but drinking passion flower tea or passiflora won't help them at all.
Wine is worse than beer for sleep because it contains tannin, making it worse.
I don't believe it is.
It's not the alcohol?
It's the alcohol.
Do you think the wedding guests at Cana in Galilee, when Jesus turned water into wine as told in the Gospels, slept poorly that night?
Having Jesus there must have made it a wonderful night.
But they might have been a little sleepy because they drank a lot of wine.
Yeah, they could have, and maybe had a hangover the next day too. It was days of celebration, not just one.
And the Gospels also say that at Pentecost, someone says, oh, they've had too much wine. So there's an old tradition. Let's call it a tradition. But humanity has been getting drunk for a long time, right?
Yeah, especially to celebrate something, right?
And for a long time, we've been losing sleep.
A long time. But back then, people could often sleep more than they do now, right?
I was about to ask, do we sleep worse than our ancestors?
I definitely think so.
What are the factors besides cell phones, which we already know are drastic, right? Social media, blue light. What are the other factors that have harmed our sleep? Television's invention disrupted sleep back then.
A problem too, yes. All technological advancements have been, right? Today, I think the problem isn't really working from home, it's the smartphone. You can take work home, communication is all the time, you get news, you can talk to a relative or a boyfriend all the time. Before you'd call, talk for 20 or 30 minutes, hang up, and that was it. Television also had few options, so there wasn't anxiety about how many people.
There were 5 channels there, right?
People often visit then. On services like Netflix, you spend more time picking a movie than watching it, and sometimes you just decide not to watch anything at all.
It happens all the time. You search, 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 and in the end you say, I'm just going to sleep.
Yeah, I'm going to sleep.
Yeah. Is there anything else that can help? I also have another question. Eggs, I don't know if it's just in my head, but if I eat eggs at night, I feel like I sleep worse. Isn't that nonsense?
Man, unless it's something I don't know about. But for me, personally, I've never heard of that. I don't think so, but if it bothers you, maybe.
Maybe there's no clear reason.
No, it's not something that general, right? Remember that the egg has a lot of things, right? A lot, even in the dough. I'm thinking about the egg itself as a substance, right? So, for example, my parents, they eat it every day. They live nowadays in Bahia, right? Well, actually, they've been living in Bahia in the countryside since 2000. The city is Barreiras. Every day at 6 p.m., they eat couscous with an egg for dinner.
They live in Bahia, so
I've already warned them about coffee, but you can't take it away from them.
don't take it away at 6 p.m. That's when they go to sleep.
My father does, my mother doesn't. My mother is more anxious.
She can't persuade her mother. Being a saint at home changes nothing.
Doesn't work miracles. I tell mom to put her phone down, but she says it's her only time to watch something.
What is your little medal?
Saint Benedict? My wife gave it to me when we found out we were expecting Mathieu.
Mathieu is your son. How old is he?
He's 10 months old, turns 10 months on the 3rd.
He's not letting you sleep? Yeah.
Yeah, nowadays he lets me, he's being good, but before he let me sleep less.
You only have one.
We only have one.
We have one on the way.
Not yet. We're still in that phase. Not quite there yet.
Did your wife have postpartum depression?
She didn't have postpartum depression. Everything went smoothly.
The home remedy miraculously helped her sleep.
So she never had trouble sleeping. Cece is someone who sleeps well. She's more of a morning person than I am, right? So if you think about sleep chronotypes, there are morning types, there are intermediates, you know.
What is that, chronotype?
Chronotype is a person's tendency to sleep or stay awake at certain times of day. Morning people usually sleep and wake up earlier, while evening people stay up and get up later. Yeah. It's not that it's normal for an evening person to sleep at 4 in the morning. It's never normal, okay? An evening person sleeps around midnight, an intermediate one at 10:30 or 11, and a morning person about 9:30, okay?
That's natural when it comes to sleep.
It's natural. And they also tend to wake up earlier. And there are also different sleep durations for each individual. Some people are short sleepers needing 6 or 7 hours per night, while long sleepers require up to 9 hours. C is a morning person, an average sleeper, while I'm more intermediate. I go to sleep at 11.
Which means that we're out of sync when it comes to sleeping, you know?
A little out of sync because one person wakes up at 5. At 5 o'clock, I'm sleeping. Yeah, there's no way. And she's already waking up, and then she takes him to bed. So that's been affecting me a bit, making me a little sleep deprived. It's something that's happening naturally. I sometimes try to move my sleep phase earlier, try to go to bed earlier, but many times I can't. You know, it's something that's not physiological for me. So look, I also have some problems related to biological rhythm because of this disconnection of biological rhythm between me and Cece.
And have you ever taken medicine to sleep?
I have, but not chronically. I have, like, during those phases I told you about, I took one like that. If I buy a pack, it expires. No, I don't use up a whole pack of medication. It's just for an adjustment. It's something to relieve that pressure. I know what it's like to try sleeping, fail, get up, do something else, and try again, only for it not to work. With early mornings, it's always the same, and I can't keep doing this. I take medication to ease the pressure I feel about needing to sleep, you know?
So taking medication, if it's well dosed, it's not serious?
You need to first get medical advice. I work with this, so I understand a bit about how to use it and how the medication works for you, including side effects and everything else. So for me, this way it works.
A sedative is good.
A sedative is typically an antidepressant, so it usually helps induce sleep. The benzodiazepines we discussed, like Evotrio, clonazepam, lorazepam, are sedatives. Is Lexotan one of the good options?
Any of these good?
I don't think any of them are bad. I don't like to demonize.
Does it do good? Does anyone do good, right?
Medication isn't helpful. Ideally, you shouldn't use it.
If you could tell the person, my dream is that you do something other than take medicine to improve your sleep. Look, Rodrigo, I think that after I talk to you here...
Routine?
Routine?
Routine, sleep. He loves routine, which for us, since we're often in a rush, is difficult. But the routine, a set time to sleep and a set time to wake up. So even if on that day you, I don't know, go to bed later, wake up at the same time, you get your body used to it. That right there is the time to wake up, time for the gym, lunchtime, dinner time, work time, time for some social interaction. Our body loves routine. So if I were to give a tip, what do I do to improve my sleep? Have a routine for everything, not just sleep, but especially a set time to go to bed and a set time to wake up.
But also set times for work and lunch. It helps.
It helps because these are rhythm cues. We didn't say that we have to keep looking at our watch. But when you have a set time to do things, you're signaling to your internal clock that it's that time, you know? So you're regulating it right there?
The phone. The invention of the phone was another problem. For sleep, I imagine.
I think less than, say, light, right? The cell phone.
Not the cell phone.
For sure. But the telephone itself,
Don't touch the thing.
it's more on hold now. Alert.
No?
Are you listening?
The phone is ringing. It's ringing. Look.
That one. This one is old, huh?
Hello, Dr. Guilherme. He's here. He's here. Yes, what is it? No, he's chatting with me here in the kitchen. He doesn't want to talk.
He doesn't want to talk. He's eating some salami.
Dr. Sono is him. It's really him. He's an American doctor specialized in sleep. So you can't make me fall asleep just by looking at me? My insomnia is really bad. What can I say, man? Are you capable?
You can say that we're going to work a miracle.
I'll speak Portuguese. It's translating automatically, right? So he'll work a miracle. Question?
Question.
That's what I say.
Don't tell him, just pay and post it.
Okay, sir. We have a battalion. Thank you. Go to sleep. Leave us alone, right? You're going to make me sleep well?
Let's go.
You can.
It depends, but we try everything. Go to sleep.
So,
In medicine, we pause before making promises or saying that doing X guarantees result X. I joke that medicine is like math, and sometimes my patients are engineers. When he asks quantitative questions, it's like, what's my percentage chance of getting better? Medicine is not math.
let's go to our third act. Let's go. Afterward, I'll ask you to keep your promise there, or at least try to help me sleep.
We're not going to.
Let's.
We have to investigate some things, right? We have to investigate the apnea. We have to.
But before that, I wanted to suggest a reading here since you told me you're religious. I'm not doing this for religious reasons, but more for historical reasons. I picked out two passages from the Old Testament here. One of them is from Job, okay, which talks about, I'll read it first. You'll be confident now that there's hope. You live troubled, but you will lie down in peace. You will rest without fear, and many will show you kindness. But the eyes of the wicked grow dim, their refuge fails, and their only hope is to give up their soul. He's referring to righteous sleep.
He's referring to the sleep of the righteous?
Today we can grasp the concept of the sleep of the righteous. What does that mean to you?
Maybe that's you. But look, isn't that interesting? He presents sleep as if it were a reward, right? Uh-huh.
But it's not.
So exactly, that's how good it is, right? Because of how good it makes you feel, you can sleep peacefully, right? Closing your eyes and surrendering might not be about him, but something everyone deserves.
If we think about being comfortable, lying down comfortably, relaxing, I wanted to see you, I'm relaxed. Today I'm Dr. Sleep, I'm relaxed. I want you to fall asleep before I do.
So good, okay?
You can close your eyes if you want. I think that's how it is. One of the interesting things about the Bible, besides its religious function, is that it brings us information from the past and the Old Testament. It was written about 2,500 to 4,000 years ago. It shows that even then, sleep was seen as a reward, and sleeping well was already challenging. This makes me think insomnia is an age-old human affliction. And then I keep wondering, what did they do back then? Do you have any idea what could be done when they didn't know?
We just know it was a time before medicine advanced, right? Antibiotics, for example, were invented not that long ago.
Penicillin is pretty new, right?
People once died from simple tooth infections. It's crazy to think about that.
They didn't have cell phones. They didn't have any of the distractions we have today. What did they do?
You don't have to look that far back. Insomnia medications only began in the 20th century, right? It's recent, not just from the past. It's been around a long time. Medicine has evolved exponentially in the past 100 years. That's why we talked at the beginning about artificial intelligence, and now it's entering medicine as well, and it's really scary. So we don't know where this is going to end, right? That's why you asked, do you believe that I believe? I think nowadays we have, at this point, you can't really doubt what's possible anymore.
Artificial intelligence keeps me up at night for a lot of reasons. But is there anything it can do for our sleep based on your research, your knowledge? No.
I believe that if it's used properly for good, I think it has everything it takes to help, to really help.
We can even think that artificial intelligence might interfere with our sleep as a curative method that could come from it.
I believe so. Thinking about an intelligence where you can show it some patterns that you follow. Transcribe to it what has already been done in terms of diagnosis, etc., and ask it to help you establish some healthy habits. It gives you everything, man, and it's already here, not something that's coming, right? So if used well, I believe it can help, yes.
Sleep is sometimes also seen as laziness, right? There's another passage I set aside here in the Old Testament that shows how the view of someone who sleeps a lot as lazy is also ancient.
Maybe he's just a night owl, isn't he?
Look.
You understand?
Explain.
No, because the afternoon person is seen as lazy. Remember, in Act 2 we discussed chronotype repeatedly.
It's just that he sleeps later and...
He wakes up later. He's not always lazy, just more of an afternoon person.
So do you think it's good? Here are some verses from Proverbs in the Old Testament. See if this is what you're talking about, if you would identify this as an afternoon person. How long will you sleep, O sluggard? When will you get up from your sleep? A little sleep, a little slumber, a little folding of the hands to rest, and poverty will come upon you like a vagabond, and scarcity like an armed man. And then...
See, yeah, so maybe the guy is just lazy.
Could be, right?
But he implied that it's something he keeps doing all the time, not just at a specific moment. Sometimes he stretches, sometimes he crosses his arms. It seems like it's something that's ongoing. Every time you look at him, he'll somehow be doing nothing. So there's...
But as a sleep doctor, you don't think sleeping a lot means someone is lazy.
Sleeping well?
I would say it's a treasure. I can definitely say that.
I think that anyone who sleeps much more than normal should investigate whether they have some other problem like hypersomnia, right? Something that is making them need so much sleep.
But there's no way out. If you sleep too much, it's bad. If you sleep too little, it's bad. That's how it is.
You need to sleep as much as your body requires. So, self-knowledge, understanding what your chronotype is and how much sleep is enough for you is the biggest key. Whether you need a nap in the afternoon or not, I myself am a guy who benefits a lot from an afternoon nap, but a short nap, about 20 minutes.
You can manage it. Why is it good for you to sleep for 20 minutes?
I don't know why, but maybe it's something genetic. Because my father did it his whole life. My mother can't do it, but my father did it his whole life. After lunch, he took a nap. So today, when I can stop for 20 minutes wherever it is, just close my eyes. I can even be sitting, just close my eyes for 20 minutes. I feel much better that way, you know? But right after lunch. So it's something that for a long time I couldn't do because of my routine, you know? Anyway, after finishing medical school, then starting my residency, then doing I don't even know what now. Nowadays, since my schedule is more relaxed, I can often stop after lunch and take a 20-minute nap.
You mentioned when we were talking inside, a question came up about spirit, about the possible supernatural aspect of a certain situation. Are you religious? Do you believe that there is a spirit separate from the body? And I ask, could this spirit be responsible for you not sleeping? Or on the contrary, is it the body that disturbs the spirit? From a religious perspective, what kind of relationship could exist there?
Spirit outside the body? No, I believe in that. I believe that each human being, of course, is unique, right? But thinking about what we really believe in, I think the more we are in tune with our own spirit, right? And more in union with the divine spirit, the Holy Spirit, I think we have a better relationship with everything, right? Including our sleep. I really believe in that, but it doesn't mean that it's something, sometimes people get it confused. That being religious, always going to church, always strictly following what a certain doctrine tells you to do, I don't think that's what it is, you know? It's more about spirituality, less about religion. So I think it's about being at peace with yourself, whatever you believe in as a greater good. Knowing that there's something more out there and you believe in it. Being in tune with that. I think it leads you to have a more fulfilling life, you know? And then within our models, which we believe is the Christian model, I really believe in the Holy Trinity, you know? Being there more and more, the more filled you are with the Holy Spirit. The more you can have this connection, ask for discernment about things through Him, the better you can guide yourself through this world we're in. We believe that it's just a passage.
Do you really believe in the sleep of the righteous? So, those who live according to principles considered more just, who seek a more legitimate truth, who try to live in a more genuine way, these people will also tend to sleep better, to have better sleep and dream instead of having nightmares.
I believe so. And if we go further into Eastern culture, many times we see Buddhism there. The people there who practice it often have a life almost entirely devoted to spiritual and mental matters. You see how they approach what sleep means to them, how important it is for them. Also conscious wakefulness and often conscious sleep. The person is able to sleep while maintaining consciousness. Some things are really...
Do you believe it's beneficial?
I believe so. The more you have control, or rather understanding, it's not even control, it's self-knowledge of what is your foundation, your vital energy. I think it's easier for you to deal with the various situations that will come up for you. So I truly believe in that.
Meditation solves it.
It can help. Meditation is one of the practices we recommend for the patient.
It's closely tied to Buddhism. Does it make sense that someone connected to Buddhism might sleep better than others?
It depends on the practice they have. I believe that, as I said, because they have practices that really become part of their daily lives. I believe so. I even have to adjust the noxismo here. We're talking while lying in a hammock, so I believe so. People who practice not only Buddhism, but any practice, people who are also Christians, who have the habit of... Prayer is a meditation, right?
So, do you think that people who are more religious, who pray more, will also tend to sleep better?
It's not that they pray more, but that they're more religious and feel a stronger divine connection. I believe so, but only if they can maintain balance in their life. We know of many priests who, for example, have had depression, insomnia, and they're priests, right? So priests don't have insomnia? No, of course they can have it. So I think it's all about balance. We need to have balance.
We talked about meditation, we talked about tea, and also about mushroom tea. It helps people shift their usual state of consciousness, which can also improve sleep.
I'm not sure what's in mushroom tea, but I think anything that changes your consciousness might not be positive. Okay? I'm saying this even based on studies about cannabis as well. So it reduces sleep latency, but it makes you sleep worse.
So, for example, cannabidiol oil isn't good.
So actually, when I'm talking about cannabis, I'm talking about marijuana here. Mainly the active tetrahydrocannabinol, which is the most hallucinogenic, right? Cannabidiol. It interacts with the endocannabinoid system, which is widely studied for insomnia, but evidence is still lacking. So it's good to make it clear here that there are studies showing treatment with cannabidiol actually, right? It's cannabidiol for insomnia treatment. Do you have a friend? My doctor friends who treat insomnia say they see good results, but it's mainly clinical practice. But nothing that's concrete in the literature. Even at the World Sleep, which was in 2013-2023, it's the World Sleep Congress. Studies and debates found no correlation. I'm not being skeptical, right?
But in 2013, you were already far away.
2023, in 2023, Rio de Janeiro, here in Brazil. So I think there could be something there. We still need to consider what the literature shows, right?
The literature doesn't mention cannabidiol.
It still doesn't mention it as a treatment for insomnia.
It's experimental for now.
It is experimental.
Do you think that if we believe something will make us sleep, even if it doesn't, it will actually make us sleep?
I believe so.
It's a placebo. The placebo exists.
Remember when we talked maybe in the first or second act about melatonin? One patient told me, I started taking melatonin and it changed my life. My sleep improved 1,000%. I'm going to take melatonin away from this guy? No, right? I'm going to create a problem.
Even if you think it's unrelated to melatonin?
It has nothing to do with it. If it gives you any side effect, it's not good, so there's no point, you know? I'm not going to mess with what's working knowing that it doesn't cause any harm. One thing is causing a side effect, another thing is not having any side effect.
You mentioned something earlier called sexonia that I found really interesting.
What's sexonia?
Sex is good for sleep. It helps.
Sleep, it's good. It helps you relax, right?
It helps?
For sure, it helps. It produces hormones like happiness, serotonin, which we know will keep deep sleep. Keeping rapid eye movement sleep is wonderful, just like physical exercise, right?
Sex has a similar effect as physical exercise.
Sleep is yes.
So having sex every day is good.
Man, it's really good.
It's good for your health.
Man, go ahead.
There are no contraindications.
No contraindication.
Okay, so why doesn't counting sheep help me sleep?
There, it could be that you're in a more pronounced state of hyperalertness.
At night, I wake up, I sleep well until 4 in the morning, then I need to go to the bathroom. I go pee. I'm so stressed I'm already dreaming about it. And when I return,
It's over. First thing, how is your water intake at night?
I drink water all day. If you noticed, I did.
I've noticed you drink a lot of water and don't stop at night. Let's try to cut back and delay bathroom trips to see if that helps. What you have is maintenance insomnia.
Maintenance insomnia.
There are 3 main types: onset insomnia, maintenance insomnia, and early awakening. Maintenance insomnia. That's it. You woke up in the middle of the night and boom, your brain turned on, started working, and then you can't turn it off. So what you apparently have is maintenance insomnia. So the first one,
First, I need to address what's waking me up.
it's what's waking you up. That's it. So maybe that's it, because regardless, let's say, I'm not saying this, but let's say we start a medication that will make your sleep deeper. You're going to feel like waking up to go to the bathroom anyway, right?
And then it will be hard to fall asleep again.
Yeah, maybe you'll even be able to sleep, but you have that awakening. So for you, this waking up is harming you. So if we can delay it, even by an hour, it's already beneficial for us. It helps us gain an hour. Even half an hour, we've gained half an hour. We always have to work this way, thinking like this before considering anything else. Then go deep into it. What woke you up was needing to pee. What kept you from going back to sleep?
I'm not sure. Then your mind races.
Your mind races. How's therapy going?
It's not.
Huh.
It's not.
Sometimes you need escape points. How's the physical exercise?
There are good and bad phases. Now it's a bad one.
So you see, you've already told me you're drinking a lot of coffee. How is it? How's your routine, your schedule?
It's not.
It's not, you see, so first you have these little things that are very important. I sometimes joke that changing your routine is just like treating rhinitis with saline. Sometimes the patient just goes to the clinic. Oh, doctor, I'm sneezing a lot. I'm constantly having sinusitis, rhinitis, you know. Clean your nose. Will that fix it? Maybe not, but washing your nose is the first step. Do the basics right and it will work perfectly. We start with the basics, then we move on to the second step, which is medication and other things, you know. But if you're not doing the basics for that, then there's a problem. So first you need to start with the basics, the simple stuff, then we go deeper, you know.
You broke your promise, that's fine, but now you're making me sleep.
I will. Now I see that it's easier. Yeah, it is.
It's easier.
You can't just say that's it. But you can start since others already do everything. Hey doctor, I sleep on schedule, no longer use caffeine, exercise daily, and take no medication. Man, that's it. There's nothing left from the part we work on, the behavioral part, the basics, right? That's already well done, right? Sometimes we need to send this guy directly to cognitive behavioral therapy so the therapist can dig deeper and look for other issues.
I've already given you all the tips.
You've already received hints and my guidance so you can start trying these things, but if nothing improves, next, we'll start cognitive behavioral therapy, so I'll suggest a therapist to assess you with me. Let's also look into the lab tests to see if there's any metabolic or hormonal changes that could be contributing, and let's check for sleep apnea.
You have to spend a night being analyzed.
Man, you need a polysomnography, right? There are different kinds like type 2, which is the full version we offer at the clinic. Even if you do it in the lab, it's actually done at your house. A technician goes to your house, sets you up, you sleep there, and the next day she takes everything off. Patients without risk factors contraindicating home polysomnography can do it at home. I even think it's better since it simulates conditions more accurately. Sleeping at home means your own environment, time, pillow, and mattress.
What if I said your talking here makes me sleepy?
See, we've already found one. I'll record a... Just kidding. There's a YouTube channel. Play me there.
It's not about what you're saying. I mean, it's not what you're saying, but like a sound when I'm tired, sleepy at the end of the day.
No.
Constant sound helps me sleep. Music is good for that.
Right? But you see, look, it's your internal clock showing you that it's time for you to relax. Now, what time is it? 6:30. It's time for you to slow down. And if you don't respect that, if you try to schedule something in the middle, do something like that, you're breaking this signal your body's giving you. So at some point, it's going to give up on you. It's going to say, okay, there's no point in signaling anything to you if you don't respect it anyway. Wake up at 4 a.m. and stay up.
You suggest that I listen to you now, stay here sleeping, and let me leave.
Not to reduce your sleep pressure, but to respect your relaxation. Now you're going home. You're going to take a relaxing shower, put on your music, read your book, and have dinner earlier.
I'm not going to talk about any problems.
You're going to cut back. You're going to start reducing a little bit. Your water intake, drink slightly cooler water in smaller amounts. Just to let your brain know that you're hydrating yourself, so you'll start reducing your intake. Let's see if that helps. Take a deep breath.
It helps.
It helps with the exercise. I have a podcast. I don't know if you knew. It's called Durma. It's really cool. We interviewed Marcelo the other day. He's a specialist in mindfulness for treating insomnia. And he trains professionals to teach mindfulness to patients.
He said breathing was good.
It's one of the first points of mindfulness, right? You do conscious breathing. It's a different position than meditation. You're upright in a chair, focused on your breathing or signals, not sitting traditionally. So yes, for sure we've already stopped to think that we don't breathe consciously during the day. If you pause and say, I'll breathe for a minute, notice your body's reaction. Sometimes it's nearly euphoric. Everyone watching, try deep breathing for a minute and take in the air. We often don't oxygenate properly during the day, which is important. We're always talking, conversing, and rushing, and we don't have conscious breathing. That might make us live in a state of maybe hypoxia. breathing less than we should, but we're breathing maybe less than what would be best, right?
The cell phone next to the bed?
Is really distracting, right?
It's better to keep it away.
It's better to keep it away, especially for people with insomnia, because sometimes actually you need to have a micro awakening. You glance over, see your thing where you left it, then realize it's 5 o'clock and you have to get up in an hour so you can't fall back asleep.
Guilherme Brassanini,
Doctor,
sleep before I go to bed. I want to thank you. Thank you.
I'm the one who should thank you, doctor.
Thank you for the wonderful conversation.
Hope you enjoyed it and I fulfilled my role. Thank you.
Am I fulfilling it?
You also have to make people aware of what sleep is, right? Not just the technical part, right?
Very good, thank you. I'll call later to schedule an appointment.